I would argue that heart disease is the number one women's health issue, although many women don't believe that or don't think about it that way. Heart disease is the number one killer of women, killing more than 500,000 women each year. Since 1984, more women than men have died of cardiovascular disease in each year. So it really is by far and away the number one killer compared to many of the other illnesses that women associate with women's health, such as breast cancer and cervical cancer and the like. So I think for that simple reason and the fact that we know that many women are not aware that this is their number one killer, I think we realize that healthcare providers are getting on the bandwagon in this regards, but women are not. So we can't emphasize it enough. I think the second reason that we need to really put women and heart disease on the map is that for the most common type of heart disease, coronary artery disease or coronary heart disease, we know what causes it, we know how to prevent it, and we know how to detect it, and therefore women have a lot of power in terms of how they live their lives, the choices they make on a day-to-day basis, their interaction with their healthcare providers that can make a difference and actually prevent or delay the development of heart disease. And I think the third reason that women need to know this is that as all people age, men and women, this becomes more prevalent, meaning that more women and men have it as age. And men and women both who have heart disease can live well with heart disease with today's treatment, assuming that they recognize the symptoms and the signs and get to the doctor quickly. So all of those things, the awareness and the opportunity for prevention of heart disease and cardiovascular disease are the reasons we need to focus on it more and more.